Here, MSF manages the paediatric inpatient and nutrition services. Malaria is the primary cause of hospital admission and death. During the high transmission period, the number of children in the hospital can go beyond 300. MSF has been looking for ways of detecting and treating malaria at an earlier stage.
In Conseguela, there are 17 villages. In each village, we have a contact person who is a community worker and who lives in the village. They help us to do the vaccinations and to treat cases of simple malaria for which there are no complications. We've taught them to do a simple and rapid test that tells them whether to put someone on anti-malarial treatment. And all the complicated cases, or people whose test was negative, are referred directly to the health centre.
The rapid diagnostic tests for malaria have revolutionised the management of this disease. They detect the presence of parasites in just a few minutes, so we can immediately tell whether a fever is due to malaria or to one of many other possible causes.
We've taken his temperature. It's high. The test has confirmed he's got malaria. He also has diarrhea. We've started him on malaria treatment, and now we're going to refer him to the Conseguela Health Center, mainly because of his persistent diarrhea.
After a bite by an infected mosquito, it takes about 3 weeks for the clinical signs of malaria to appear. If we administer preventive treatment during this incubation period, we can stop the disease from developing. This year, during the high transmission period in August, September and October, MSF distributed combination anti-malarial drugs once a month to more than 165,000 children aged 3 months to 5 years throughout the Kutiala Health District. This is the first time seasonal malaria chemoprevention has been carried out in actual field conditions.
Until now, when children had malaria, we could only treat them once they were already ill. But this year, we've started doing preventive treatment. So during the rainy season, the season when we have the most malaria, we give them a course of treatment at the beginning of each month to prevent them from contracting the disease.
The initial results have been very encouraging. There has been an almost 70% reduction in the number of patients admitted to hospital with serious malaria in the district of Kutiala. Ami Diabate lives in the village of Finsankoho. Her 3 children have been given the preventive treatment.
My children used to get fevers all the time. Since they've started taking these medicines, they've had almost none. I used to take my children to the health center about 3 times a month. Now it can be more than a month before I have to go back.
The paediatric program in Conseguela is based on a series of simple measures: vaccination, prevention and early treatment of malaria, and food supplements specifically designed to prevent malnutrition. A glance at the growth charts of the children admitted to the program shows how effective these simple measures are.
We
have a good participation rate, which stands at 95%, and the most important thing is the big reduction in mortality rates. According to what the villagers tell us, since the program started, they've seen fewer and fewer deaths in the villages. There are fewer and fewer children's graves in the cemeteries. This is remarkable news, and it encourages us to keep going.
When my son was 6 months old, he started getting the food supplement. He has also received all of his vaccinations, and he's been fine. He doesn't get ill, and he doesn't get fevers like his older brothers and sisters did when they were his age.
The children used to say they didn't feel well. That's changed too.
I've really seen the benefits of this project. Since it started, we don't hear about children dying so often. The supplements help us to keep malnutrition at bay.